Welcome to BoombosticHealth, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Well, hello, everybody, and welcome back to episode 41 of the Boombostic Health podcast. I am your host, Bradley Bostick. I have a very knowledgeable guest on today that I'm excited to talk to. In full disclosure, she also is a colleague at HC1, where I'm CEO. Tiffany has spent a lot of her career focused on maternal health and has a specific area of expertise and a passion around making the United States much better at an area where it is shocking how poorly we're performing with respect to keeping mothers and their unborn children healthy. Tiffany, thank you so much for being on the show.
Thank you so much, Bradley. I'm excited to be here and to cover such an important topic.
Just to more fully introduce you, Tiffany's role is really leading the blood management solution offering. That's a clinical offering that helps identify ways to optimize blood utilization and really benefit patient care by ensuring you're only transfusing when it's absolutely necessary for the best of the patient, and also that you're being preventative and proactive to do other things in advance of procedures or important life events like having babies. Tiffany, do you want to just take a couple of minutes and introduce yourself a bit and give our audience a better understanding of the lens you're looking through on this?
Sure, absolutely. So I have been in the healthcare field for a long time. Been a nurse since 1989, but I've been really focusing on better outcomes for patients, and it started with anemia management. And I've been doing patient blood management, anemia management for years, and then was fortunate to be able to join up with HC1 and really push our solution for software. So I really believe that we should help providers to do their jobs easier. So as a nurse, to be able to kind of own, as a product owner, a software solution, which is My Blood Health, which supports this HerCare workflow, is really an honor to be able to find ways to make it easier for people. It's a solution, right? So we want to be more proactive. I really believe that the patient is the most important part of the picture. And what can we do as healthcare providers to be smarter, leverage technology, leverage tools that can help them to do their jobs better? Putting that into a software solution to really kind of solve problems and reduce gaps in care, I think that's important here, is what we've been focused on here. And I really, as a nurse, bring that expertise forward. I hear stories all the time about, patients that had anemia that was ignored and patients that get transfusions that they didn't need to get. And then you hear outcomes for maternal health. But it's a big deal for moms to have a baby. It's not risk-free, right? And also, having poor outcomes as a mom also affects the child, the baby. So we really are doing a service to the patients, mom and baby, when we can proactively identify issues earlier. I think that's been a big problem in healthcare. They're more reactive. Wait till there's a problem, we react to that problem, and then we try to fix it, right? But if you can switch that focus to a proactive approach where we can, for this solution, leverage data and laboratory insights to really pull in clinicians' need to take care of that population, it really is impactful as far as what I can do as a nurse in this field to really make a difference. And I really see there's a big opportunity for us to really help providers and health systems to achieve this, to really have better maternal health outcomes.
And, the best thing about working in a challenging industry like healthcare, where it's not the easiest place, it's really the great people that you get to work with, which, Tiffany, you definitely are in that camp because you're so passionate and knowledgeable. And it's also the impact that you're making on patients. And oftentimes we're talking about advanced diseases and identifying people who are in complex medical situations that have lived their lives for a certain point. In this case, we're talking about the most fragile patient, and that's an unborn baby is where we're focused. Is that a fair way to put it?
An unborn baby, yes, and a mother of the unborn baby, absolutely.
So why is it that there are so many resources in the country of the United States, and we have so much technology and so many people that are out there delivering care, yet we have this massive, strange drop off in the health and survival rates of babies. Like, could you talk about how big this issue is, what the numbers really are, and what some of the reasons are for that?
I think for the United States, I think one of the biggest reasons is we have a very fragmented healthcare system. We don't work together, we don't talk together, and then there's a big, I think, missed opportunity of recognizing the problem of where moms that are having babies have risk, right? So oftentimes they don't identify any risk or the risks that are modifiable early enough. I say we see in time that moms that are having babies, they do check sometimes if they have access to healthcare, but they'll check hemoglobin. They don't necessarily look at the iron studies at that time, right? They say, oh, your hemoglobin is normal. It's 11.5 for what they say for maternal health care. They're not looking deeper into, do they have iron deficiency? Because iron deficiency is important. Are they looking at the full picture? Do they have a history of already having a previous pregnancy? Have they also had diabetes that was not managed in the previous pregnancy with gestational diabetes? Do they have chronic kidney disease? Are they hypertensive? So these are things they look at, but we're trying to identify it earlier and make a difference with that proactive approach. And I think with the fragmented healthcare system and lack of resources, have hospitals that are closing. You have disparities in like healthcare deserts, right? I don't know if you've seen on the news recently. I know I'm from Maine. We see a lot of the smaller hospitals and maternity units are actually, there's not an easy access of care for those patients to, number one, come for proactive care. Number two, deliver in a safe manner. So I think that that's really a big issue. And then we have our racial disparities and kind of access to care that have really played a big part in here as well. But I think the fragmented system is really kind of broken. We need to do a better job of thinking, how can we, first of all, recognize there's a problem? I think there's an under recognition of this issue. And number two, really put together a mindset that we should be more proactive, reactive, but putting this as a standard of care. It's not hard. It's not rocket science, but you have to implement the standard of care and actually follow the patient and then leverage technology, especially something that can help providers working remotely, for instance, right? If your patients can't get to you, we need to make it easier to have telehealth visits and access to that kind of assessment and pulling the patient through the continuum of care. So I think there's a lot that we should be doing as a country to really pull that together. And I think it's between policymakers, providers, even patients. Patients should be empowered to ask questions and know that, this is their life and their body. They want to do the best that they can to prepare for a delivery and prepare for a healthy outcome with their baby.
Okay, so put a fine point on it. What's the statistics specifically as it relates to infant mortality?
So, well, there's statistics as far as the disparities and the biggest impact to mortality. So we see, for example, with the Black and Native American population, their mortality rate for delivery, 49.5 patients per 100,000 live births compared to 19 of the white patients. So I think that there's that disparity there as well. So we're seeing much higher rates of mortality, morbidity with maternal patients that are from the disparity populations.
And then the specific lever that the HC1 offering is pulling here to make that better focuses on anemia. Could you explain that a bit and why it's such a huge risk factor and how it is that you can identify and address that?
Yeah, absolutely. There's up to 40% of patients. Anemia is common. Let's just start with that. Anemia is a very common modifiable. I think that's the important part, risk factor. And there's a global prevalence of anemia. Up to 40% of pregnant women have anemia. And anemia itself actually contributes to a lot of the other healthcare problems in maternal health care. We have a higher rate of hemorrhage. We have a higher rate of cardiovascular conditions, a higher rate of mental health issues with depression, all linked back to anemia. So that is a big foundation, but we want to focus on all the other areas as well. For anemia, we know that in the first trimester, 18% around are the average amount of moms that come in with anemia, but that increases dramatically to up to 80% in that third trimester. So there's a missed opportunity. If you don't get it early in that first trimester, you can't, you have to deal with a bigger problem, 80% versus 20%, right, in that first trimester, where we can really make a difference early on. So the software solution that we use for HerCare actually ingests patients automatically into a virtual waiting room, and it pulls in a patient based on a pregnancy diagnosis. So that happens way earlier than the common pathway of a referral-based program. So in that episode of care, it also pulls in, as soon as they're ingested, any lab work that the clinicians really are most interested in seeing for their maternal health patients. So we're looking at hemoglobin, we're looking at their kidney function. We're looking at their diabetes. We actually can also pull in clinical parameters like hypertension. So that all can come into the work list to really pull a full synopsis of a maternal health care patient for the clinician or care team to manage. So that's pretty novel, I think, that it can pull all of that in early, right? So we have seen patients at the third trimester that have gone through this program. Actually, there's a hospital that uses our software. I'm not going to mention their name at this point, but they have studies to show their admission to delivery hemoglobin trend since they've been following this pathway has instrumentally gone up significantly, and a nice trend upwards. Those patients that actually get identified early and optimized come to that delivery with a much higher hemoglobin than prior to using the software. So I think that's really impactful to say. We know this works. Again, early proactive intervention, pulling in those labs and the diagnosis data and the clinical indication for hypertension. And then in this tool itself, there's visualizations for the healthcare coordinator to make their job easier. So it pulls patients in very high, quickly shows them who are my most at risk patients. It tells me at risk, right? There's red bars, there's icons. So they don't have to sort through lots of different charts. It's all in one place, all your pregnant patients in one area to better identify who they should focus on first and then really maintain them through the continuum of care. And the other nice part of this, I think that's a gap in care as well, is postpartum follow-up. So this actually allows them to follow a patient from beginning to end and after discharge. If they need additional monitoring or treatments, they come back in. So that mom is really in the best shape possible to recover from her pregnancy and to take better care of her baby. There's a lot of studies that show a decrease in postpartum depression when you don't have anemia coming into that delivery, right? That you actually do better, you have more energy, you're not as depressed, having that depression issue, and you're able to really take care of that baby to the best that you can.
Why is it that anemia is so such a huge risk factor? Why? Because people hear about, I remember the ads about iron poor blood and that kind of thing. But I don't know that anybody just in the general population would pick up on the fact that this has a big impact on mortality for expectant mothers and their babies. Why is that? Why is it so serious?
Well, I think, again, it's probably a symptom of us not paying attention, right? That anemia is so common, especially in women. They're like, oh, they have heavy menstrual bleeding before they deliver. A lot of women that get pregnant already have anemia and don't know it, right? It might be mild, but you need a lot of iron stored, right? Your body is going through great cellular change, right? And you need iron to do that, as well as build your healthy blood cells. So if you start out at a deficit, then you get pregnant, you're behind very quickly. And I think that's something that we need to educate our patient population as well. We should be taking better care of our bodies and pay attention and working with our primary care to make sure we are not iron deficient before we get pregnant, that we have healthy blood counts, that we should be expected to go into a delivery with a high blood count and normal iron stores if we follow this pathway, right, to reduce those complications. And it's not a difficult thing to do. It just is identifying it and understanding it is a risk that's modifiable, and we should put some interventions around that to really make that a priority, that we should be screening even our teenage patients, right? So it is very often missed and not benign at all.
So if you're going in for a routine physical and you're having the consult with your physician, should people be saying, I want to know what my iron levels are? Or is that a
Absolutely.
test
It
that
should
they
be part,
should?
yeah, it should be part of any screening, especially right after you start as a teenager. When you start your menstrual cycles, that's an important conversation for a parent to bring to the physician so that we can start early, right? And then as you're growing into the part that you want to have a child and you're in that childbearing age, it's very important if you're planning to make sure that you come into that pregnancy healthy. Of course, that doesn't happen with every pregnancy. They're not planned, but again, screening early. So that's, I think, identifying a patient's iron level is actually almost more important than their hemoglobin when they're pregnant, when they start out, right? So let's get that done early so that you can intervene. Oftentimes, if you can get them in the first trimester, you can start the oral iron supplements to really bring them up, and then you continue with this program to reevaluate them throughout the continuum of that care. So maybe they're still, even if they've got a supplement, needing intravenous iron or something like that in the, second or third trimester. But again, it's important to have those conversations and plan for what you're going to do to really improve your blood health.
So you can boost iron through a supplement that you just take orally?
You can. So it depends on how bad your deficit is. But if you have time and you can tolerate an oral iron supplement, a lot of people can't tolerate it because it causes GI side effects. But there are some more easily tolerable iron solutions on the market. But in the first trimester, you would start with oral iron and see how you're tolerating it, reassess those labs and see if you're able to maintain. If you're not, then you can move to the other pathway where you may need an intravenous iron infusion to bring those iron stores up and treat the iron deficiency anemia.
Okay, so the IV based is a function of whether or not you're able to solve the problem without too many GI side effects using an
Correct.
oral.
And it works really fast. Like if oral iron takes a little bit more time to absorb, but the intravenous iron is pretty quick. But again, generally you start with oral anyway. You want to start to make sure you can, rule out that it doesn't work for you before you move into intravenous iron.
So having more healthy babies, more healthy mothers, that's obviously a huge positive impact on care, and closing a significant gap in care to do that is identifying these folks who need some type of a boost to their iron, whether that's oral or through a intravenous approach. There's a bigger picture though here as well that relates to blood management and the idea of being more proactive and preventative. And the same anemia problem specifically is a factor in anybody who's having surgery. Is that fair?
That's absolutely fair. Yes, we want to come in with a nice healthy blood count because we know you're going to lose blood whether you're having surgery or a baby. That's a given. Blood is going to be lost, right? And if you have healthy blood, healthy iron, and healthy hemoglobin, then you're able to tolerate blood loss without significant issues, right? So if you can start your blood count with delivery, as close to 13 as possible, you're going to have a better outcome than if you start your delivery with a hemoglobin of 10, right? Because you have to have some wiggle room for that blood loss. Same for surgery. We want to make sure that, patients and providers understand it is a modifiable risk that can be certainly easy to implement as long as you can identify them soon enough. It's the same for surgery. You can't identify someone's anemia 2 days before surgery and make a big impact at that moment in time because it takes time to treat. You need about 30 days for surgery. With pregnancy, we want the entire pregnancy event to have time to assess the patient, modify anything that we can identify as a risk, not just anemia, but any modifiable risk that was identified, and improve that mom's health before the delivery.
So, how do you think we go about increasing the awareness of this among the actual caregivers and the mothers, and frankly, anyone who's going in for surgery? Is there any kind of program that's already underway, or help me think about that a little bit?
There's lots of organizations that promote blood health and better outcomes. So and again, that's a social media campaign. I feel like it could get a much broader reach. There's some great. I think there's a new anemia awareness videos section right now on LinkedIn. I'm not sure if you saw the anemia folks that are coming out with some good around the world videos and content around that. But I think it's important that the providers also work with their educators to help get the information to patients. I think patients don't understand that there is a risk and they also have a part to play in this as well. And then when you're talking about community care partners, maybe other folks that are involved in the whole continuum need to be on the page with educating clinicians, patients, providers. We have also our political folks, right? We want to make sure that this helps. If the policy can change and they actually say we need to implement standard of care and some proactive protocols to manage these populations of folks, I think that certainly would help. And insurance providers. Sometimes it's hard to get things covered because they're not making it easy to get access to treatments. There's a lot of loopholes to get through. So I think we kind of need a whole overhaul in the US system, but just realizing there's a problem and getting it out here. Your podcast and things like this, Bradley, are important, I think, to point out that there is a problem, but there's also solutions, and we need to think about things differently. Be more efficient using technology. Where can we leverage that to really make a change out there? And then aligning with other partners out there that provide care to maternal health folks, navigating that platform with them as well may be a big significant help to these folks. And groups like ACOG, right, the American College of Gynecologic Providers, obstetricians and gynecologists.
Yeah, it seems like there's just such a good rationale for why this should be done, why you should proactively identify folks who are anemic with plenty of time to get them the right kind of care. And so if you're planning to start a family or have a child, this is something you should get started with before you even conceive, and then have an ongoing monitoring to help as you head into actual delivery. And so, if you look out 5 to 10 years, Tiffany, on how you would envision this approach being integrated as the standard of care, how would that look? And how much of an impact would that make?
Wow, I think that, there's a significant opportunity to look out 5 to 10 years, but we want to see first, we need if US healthcare can get it right, we should be improving coverage, including postpartum coverage, right, for those patients to have better continuum of care and expand access to care. When you have these deserts, these healthcare deserts, it's huge where these moms don't have access to care. These labor and delivery units have closed. It's hard to get a provider. I think that we need to also think about treatment of other chronic conditions we're seeing coming in. We as American people are not healthy, right? So there's we're seeing more and more chronic disease come out there. So people that are having babies, moms that are having babies, are coming in with, chronic kidney disease, diabetes, hypertension, because they haven't had a healthy lifestyle, partly because they don't have access to care and really having those disparities, right? And where they fall for taking better care of their health and access to providers, primary care providers doing preventative care and things like that prior to delivery. But I think overall, there's a huge impact. And then if we can leverage solutions like HerCare, I think we have a real big opportunity to reduce that gap in care and reduce obstetric complications, improve the patient outcomes for mom and baby. And really, it makes a path forward to turning the tide on this maternal health crisis to leverage technology and have a very patient-centered approach that really helps to be a holistic view, working with the patient and all the providers along the continuum.
Yeah, I think gaps in care is a concept that is gaining more and more momentum. And technology now allows us to identify those gaps better than ever. When you're
Absolutely.
in the world of paper based medical records and all these clinicians who are very busy with the patients who are in their office, there was no time to go through and look at historical trending and try to determine who might be able to be a candidate for certain proactive preventive measures. If you fast forward to then the digitization of those medical records, you then had this storage of the data digitally,
Yes.
but still not a lot of real analysis to drive these kinds of proactive measures. Now you move into this age of AI and specifically agentic AI, where you can have these agents that are constantly combing through the information to identify all of those needles in the haystack based on constellations of information that there aren't enough humans on Earth to be going through and identifying. And the great thing also is these agents can support our caregivers, and they never get tired, and they never, come in and ask for a raise. They're just there to serve the needs of the providers. And I absolutely am not in any way indicating with that statement that somehow the AI and technology takes the place of the care that's delivered by people. What I'm
Hmm.
saying is the people don't have enough time in the day to deliver the kind of care they'd like to deliver. So I'd love to see a future state where those people that are involved with women's health and delivering babies in particular, that they without a doubt would know every single time that those right connections and the right education and the right interventions had happened in order to ensure you have the best possible chance of a successful childbirth. Like, how much better would the profession of being an OB actually look if you didn't have to worry, gosh, did we miss something with this patient that we should have proactively addressed? So that's what I think about when I look out 5 years is we're wielding the power of this agentic AI to identify all those people that need some kind of care, and then getting the wheel in motion to where the caregivers are able to then engage and ensure that that care is administered. Because in healthcare, some person has to typically do something in order to drive care. It doesn't all get done by computers. And now with the compute we have and AI we have, it can give you a real power up and eliminate, I don't know, 80% of the things that otherwise you'd have to do, which are more administrative, and flip the approach to where you can spend that 80% of your time on patient care instead of going through a lot of administrative work. Does that make sense to you?
Absolutely makes sense to me. And I think, the other thing is having clinicians to tell us what they need as well and to really get our prompting well done on these agents as well and aligning with, the literature and the guidelines. We can, use the guidelines from the American College of Obstetricians and Gynecologists, ACOG, right, to help support the agentic AI and the prompting. I think that builds trust that we are aligning right now the software with those guidelines, right? So 100%, like we want to make it easier, we want to get it right, we want to solve problems and certainly have that trust that it's providing the information that they need and they can rely on that to, not to miss patients. You don't want to lose patients in the cracks, especially with this.
Yeah, and then we look at this in terms of the reinforcement learning through human feedback, meaning that whatever these models are as good as the training they get.
Exactly.
And so when you have these competent clinicians engaged and have this information surfaced, but then they're utilizing it, acting upon it, giving input into it, it continues to make everything smarter and rises the tide for all the caregivers, which is a really beautiful future and the kind of future you'd want your family to benefit from, your relatives, your friends. And it's pretty awesome to see how much progress we're making to get there. So, well, Tiffany, thank you so much again for being here for Boombostic Health episode 41. We, as everybody in the audience knows, just covered this critical topic of improving the health of newborns and their mothers in the United States. And with a specific approach using technology that powers people, you can identify and address anemia proactively, which is one major complicating factor that leads to a lot of infant mortality and also harms women. And as you said, even can have effects in terms of the postpartum side of mental health and recovery from having the child. So Tiffany, thank you so much for being on Boombostic Health, and thanks for all the great work you're doing to serve the nation and help mothers and their babies be healthier. Awesome. Well, Boombostic Health community, thank you for being here for another episode. We will look forward to seeing you next Tuesday, where we have another innovator here to talk about how healthcare can be so much better and the future is much brighter than you think. Have a great day.